Hello, guys. My name is Liz Avila, and I present to you my case study, which does go over chapter 16, which talks about infectious diseases. However, for this case study in particular, I will highlight gonorrhea. Just a warning, the people in this video are unpaid actors, and this scenario is for educational purposes only. This is 55-year-old Jeanette Yaleen. She does have diabetes and is opioid dependent due to her back pain. She does take pills for both. She is caring for her 8-month-old grandchild because her daughter is in prison, and she also works full-time as an administrative assistant. Jeanette decided to go to the clubs with her girlfriends to escape from her chaotic life.
My bad. It's okay.
What's your name?
Jeanette, what's your name?
My name's Bob.
Hi, Bob.
Wanna come over to Marcus?
Of course.
Let's go.
After Jeanette's sexual encounter with Bob, she started to experience genital itching and vaginal discharge on the 6th day. Okay, Miss Jeanette, because of everything you've been experiencing these last couple of days, I have reason to believe that you have a sexually transmitted disease, so I will be running a couple of tests to just rule that out. Thank you for your sample.
STD? I'm not a prostitute.
I understand, ma'am. This is just to rule anything out, but I will get back to you with the results.
Thank you.
Okay, Miss Jeanette, so after reviewing the results, you did come back positive for gonorrhea.
Gonorrhea? What is that?
So it is an STD, a sexually...
An STD?
Yes.
Does that mean I'm gonna die? Because I know my friend Angelina had that and she ended up dying in 2 days. Am I next?
Okay, ma'am.
Are you gonna give me antibiotics? Am I gonna surpass this? Is this for me forever?
Okay, ma'am. If you could just remain calm.
Calm?
I do see that you are very anxious about this.
I sure am.
Okay, so in 30 minutes, I actually do have one of our staff members. She's going to do a patient education demonstration over gonorrhea. Let me go ahead and sign you up for that.
Please do.
Perfect. So this is the exact same presentation that Jeanette sat through. So we do go over what the characteristics of gonorrhea are. This is a sexually transmitted disease, an STD caused by the bacteria Neisseria gonorrhea. This infection may occur at any mucosal site. The most prevalent sites of infection include the cervix in women, the urethra in men, but it could also occur in the rectum, the pharynx, or the throat, and the conjunctiva, which is the mucous membrane that covers the front of the eyes. A couple of things that we advise Jeanette to look out for are vaginal discharge, which can range in color from yellow to green, genital itching, and dysuria. Now, dysuria is pain or discomfort while urinating. It was also mentioned that some women may be asymptomatic, meaning that they don't experience any of these things that are listed here, and symptoms do appear in 2 to 7 days after exposure. If left untreated, it can develop into what is called pelvic inflammatory disease, which can present with things like fever, vaginal discharge, and abdominal tenderness to touch. For the diagnosis, we do use Gram stain examination to make this diagnosis. How is this done? This is done by obtaining a sample, which can be obtained from any mucosal site suspected to be involved, and it is tested. So I did include a picture of what that would look like under the microscope. It's under Gram stain where that you see that pink image. As for the management, this is a treatable STD. This is treated with antibiotics. Some of the antibiotics that can be used include cetrafloxone plus doxycycline and ciprofloxacin. Now, doxycycline can be used because a co-infection with chlamydia is common. Just a little disclaimer, the information provided here is for general purposes only. It should not be substituted for consultation with a licensed healthcare provider. After the presentation, Jeanette did have additional questions, but we made sure to give her a brochure which goes over everything that we talked about during this presentation, such as the characteristics. It talks about signs, symptoms, how this is diagnosed, and how is it treated. Additionally, you can scan that QR code with your phone, and it does go to the CDC's website just to provide more information about gonorrhea. Additionally, we did sit down and talk to Jeanette, and we advised her to call Bob and let him know that she was positive for gonorrhea, and that it should be advised that he tell other people that he had sexual intercourse with as well, and to practice safe sex. Here are my references. I did use the patient education book for this PowerPoint. However, I did include the CDC just because I did use it in my brochure for the QR code. But other than that, thank you for watching.